Rhode Island is a test site for early distribution protocols on the vaccine. Any intelligence you can give us as to how quickly this could get into the hands of healthcare workers once it's cleared?
Carl, we helped go over the logistics with Pfizer for the last month with the Department of Health. We're hopeful that the United States will approve it as early as next week. As soon as we get it in our hands, we can literally get it distributed out to the folks who need it within hours.
So for your purposes, who within your building, let's say, who's going to get that first? And theoretically, if this panel meeting ends on the 10th, could that happen before, say, the middle of the month?
We hope so. We're waiting to hear. We're working with the Department of Health in the state of Rhode Island as we speak to go over the criteria of exactly who will get the vaccine first, who will get it second. We haven't finalized those yet. Obviously, high-risk populations and those on the front line of healthcare, our healthcare workers, obviously will be some of the first to get it, but we haven't nailed down the specifics yet.
Warner, you've purchased dozens of freezers to store the potential vaccines, which need to be kept at a temperature of minus 75 degrees Celsius. That's obviously for the Pfizer and Moderna vaccines, the ones that are closest to approval. How difficult was it to obtain these, and how easy is it to afford them?
Well, certainly it wasn't easy to obtain. We ordered them several months ago. We have 3 of the ultra-cold freezers across Louisiana, from Shreveport to Lafayette to New Orleans. We have 26 of the minus 20 Celsius freezers that are circulated around our entire system. We could currently hold about 225,000 vaccines to vaccinate 225,000 people across our entire system. So we are prepared, and once again, we're just waiting for the authorization and to have vaccine here in Louisiana.
In the meantime, what does the capacity look like for your ICU beds and your ER right now? I read reports that hospitals in your state have had to turn people away in Louisiana.
Yeah, there's one hospital that has shut down elective procedures in the state. Here at Ochsner Health, we're in good shape. We really don't see the ICU capacity being a challenge for us. We have continued to see our census of COVID patients increase. Nothing like what we saw back in April, where we had nearly 1,000 COVID patients across our system. Today, we're about 350, up about almost nearly 100% over the past 2 months. So we are concerned, but today we think we have plenty of capacity. The real challenge today is staffing and making sure we have enough healthcare workers to take care of folks, and that is what we really are challenged with each and every day.
Rabino, similar question to you. I know there's been a spike, at least in Rhode Island. What are you seeing in terms of your system right now, and how many people are in there, and what your staffing's like as well?
Yeah, unfortunately, Rhode Island is headed in the wrong direction. We're seeing more and more positive cases each and every day. Our hospital beds are full at the moment with COVID patients. Like Ochsner, we're not seeing a dramatic demand on ICU capacity. We have plenty of ICU capacity. We have plenty of ventilator capacity. However, our regular med-surg beds are filled. It's one of the reasons that we chose to open a field hospital this week. Just yesterday, we opened a 600-bed field hospital at the Rhode Island Convention Center, and as of yesterday, we're already transporting patients from the main campuses to the field hospital.
Shepard Smith here. Thanks for watching CNBC on YouTube.